today's show, we're going to learn some things about healthcare. I have Risa with Abiding Home Health, and you've actually been with the company 2.5 years.
2.5 years.
But you went through a change here just recently.
Yes, most of our team, we all worked together for many years prior. I personally have been doing home health for almost 20 years. And, but we had the opportunity to work for a family-owned company, and that's what we started in Enid 2.5 years ago.
Wow, very cool. And it's family-owned. That was
Yes.
part of the deal, was that you kind of got to your roots.
Yes, yes, and it's more personal that way. And if I have an issue, I can call the owner and have a conversation, you know, and he can guide me or help me and get to where we can do what's best for the patient that way.
That's pretty cool.
Yeah.
You're not dealing with a big corporation and stuff like that.
Right, and sometimes taking weeks to get a response back when you need it right then.
Yes.
So yes, that took that out of that, and I think we're able to give great care.
So this is a big misconception, because I thought of all home health care is like, you know, hospice or just for the elderly, but that's not the case.
That is not the case. Home health is basically an extension of the hospital or a skilled nursing facility. We want to keep people in their home and get them back to their max abilities as quickly and safely as possible. People tend to get better at home in their own environment, and that is our goal. With hospice, you tend to help people transition that can't be cured in most cases. But with home health, our goal is to get you back so that you're as independent as possible in your home setting.
Get back on your feet and get going. And
Absolutely.
Yeah. Okay. So some of the things you offer are, I mean, not just nursing.
Correct. We do have wound care certified nurse as well, but we have occupational therapy, we have speech therapy, physical therapy, and our occupational therapist is actually just recently got her wound certification as well, and she is her lymphedema certified to be able to treat that.
What is that? What is
lymphedema?
No. I mean, what is the work therapy? Is that like a worker's comp thing, or what is?
Oh, what, like the occupational therapy? Okay.
Yes.
No, I know people say, I'm retired, I don't want to go back to work. No, they basically focus on getting people with their ADLs, being able to live independently at home. Maybe people need help getting dressed after they've had a stroke, or and things you don't think about, cooking, making a sandwich. Things like that, taking showers, being...
Life skills.
Yes, just life skills that maybe they've lost due to an illness.
I got you.
And also, they work a lot with like upper body strengthening and things. But again, our occupational therapist does the lymphedema as well.
See, and I always thought that was, while I'm on disability, I need occupational therapy, but it's
right.
Misleading title.
It is, and that's one thing they'll say, I don't need that, because people focus on physical therapy, on balance, strengthening, things like that. But occupational therapy has their own set of rules too, and they can still work on some of those things as well, but not into the depth that physical therapy does on that side.
And so one of the things is you have a certified nurse. So what's the difference between that and just an RN? Or
all of our nurses have been doing wound care for many years. I have, like I said, I've worked with most of them. I've been in home health for almost 20 years, and I've worked with them for a minimum of 10 years of the individual nurses that we have. And it's just a specialty certification. They all do wound care. They're all very capable. It's just, I had my wound care certification as well at one time. It's just a little more in-depth training, and it just kind of gives us a little edge on what products to use, when to use them, and be able to justify it a little bit more. Okay.
And then you mentioned you can do assisted living. So does that mean you go to an assisted living center, or you, tell me what
Yes,
assisted
we
living
can
is.
go into assisted living facilities, because that is the patient's home, and they are mostly independent. They do have, again, some help with their medications, but as long as we can justify a skilled need for home health, we can be in the home.
Okay.
Whether it's just disease process management and education on that side, or providing them the therapy that they need to be able to stay in the assisted living. Because a lot of those, once you decline to a certain point, you no longer qualify to be in the assisted living.
And you have to go to nursing.
And that's when you have to go into a nursing home. So if we can have therapy come in and work with you and help you, maintain and stay there safely, then that's better for the patient.
But this could also be done in their own home.
Absolutely.
Okay, so you don't have to be in an assisted living center to get assisted living.
Most of ours are actually in their own home. But we can go into assisted livings and help them do the same.
Okay, very cool. Do you cook?
Me personally?
No.
No.
Well, I need assisted living because I don't cook, so I was
right.
Okay.
Right, no.
I'm teasing you. So how does somebody employ you? I can't just call you up and say, hey, I need a nurse.
Right, exactly. We work through doctors, under doctor's orders. So if you're having an issue, which you need to go to your physician anyway, and then you can talk to them about what's best for you and what your needs are at home. So maybe we can help at that point. But we have to have physician's orders to come into the home.
And I guess that helps expedite insurance and all these other
Absolutely,
kind of things
yes.
that remove some of that red tape.
Yes.
So, very cool. So how do they reach you? Say they just have a question or something. Can they just call and ask questions?
At any time.
Okay.
Yes, and we have a nurse on call 24 hours a day, 7 days a week. So you can call us, just ask questions. We'll be happy to guide you whether you're wanting. We don't provide personal care in the home, but we can guide you and kind of give you some names of places that do. Get you some assistance in the area that gives out whether you need assistance getting food or things like that. We don't provide that service, but we can lead you in that right direction.
I know when my mother-in-law was getting on, it was very hard. There's no rule book for helping parents. And,
right.
We honestly had no idea where to go or what to do, and this would have been very, very helpful to have a resource to...
Call us, we will help you. We can, like I said, give you numbers to call to help you get what's needed. Very,
very cool. What did I forget? I think we've encompassed everything. It seems like a wonderful, wonderful service that many probably don't even know exist.
Well, and people don't always know what we provide, like I said, and how much help we can be in the home. Our nurses can help with the medications. If you go to the doctor and they've got changes and you are having questions or you just get confused if doses are, talk to your doctor about it, and they can have us come in. We can assist you with that and just make that change a little easier for you, and then we don't have to stay in forever. We're not a forever, but we can at least help you get back on your feet.
And I had, I think in a previous conversation, your nurses are in the home and present, and they can see a change. So therefore, that'll prompt the doctor to change medications and things like this that the patient may not realize.
Exactly, or even their family member, because some things happen so gradually that we're not there 24 hours a day, and in a lot of cases, we're there maybe once a week. Well, during that time, we can come in and tell you if we're seeing whether even you're pale, compared to what you were the last time. Little things happening. We always check your vital signs. We can tell you if your blood pressure is high, let the doctor know that. And that way it might save you a trip to the ER. That's our goal. We want to keep you out of the hospital.
Sure. Very expensive.
Yes.
Yes. Very cool. Well, Risa, thank you so much for hanging out today.
Absolutely. My pleasure.
Coming down and hanging out with us. So just a reminder that this, you can watch and listen to this as a podcast on any of your podcast, however you absorb your podcast. Of course, YouTube, the all about website. Lots of different ways to watch this. I think we're even on TikTok now, so you can tune in and watch that. And that's all we got for today, so stay tuned.